Welcome to today's episode where we dive deep into an essential topic eye health and diabetes, specifically focusing on diabetic retinopathy. This episode aims to equip you with knowledge about how diabetes affects your eyesight, the stages of diabetic retinopathy, its symptoms, and most importantly, ways to manage and prevent its progression. With diabetes affecting millions worldwide, understanding its implications for eye health is crucial. Diabetic retinopathy is the leading cause of blindness amongst adults. But the good news is that with early detection and proper management, significant vision loss can often be prevented. My name is Dr. Akash Sehgal. This is the Dr. WashBrains podcast. Today we are talking about diabetic retinopathy. Let's dive in. Now, diabetes is a chronic condition characterized by high blood sugar levels, resulting from the body's inability to produce or effectively use insulin. There are two main types: type 1 diabetes, where the body does not produce insulin, and type 2 diabetes, where the body becomes resistant to insulin. Understanding the nuances of these types is vital for grasping how diabetes can lead to complications, including diabetic retinopathy. According to the International Diabetes Federation, approximately 537 million adults were living with diabetes in 2021, and this number is expected to rise. The increasing prevalence of diabetes highlights the urgency for awareness and education regarding its complications, particularly those affecting vision. Understanding the relationship between diabetes and vision necessitates a closer look at how elevated blood sugar levels can harm the body's blood vessels. Over time, high blood glucose can lead to inflammation and oxidative stress, causing damage to the vascular system. This damage is particularly pronounced in the small blood vessels of the retina, where it can lead to diabetic retinopathy. The retina is uniquely vulnerable due to its high metabolic demand and reliance on a delicate network of blood vessels. Damage to these vessels can lead to several issues like microaneurysms. That is the weakening of the blood vessels which causes small bulges in the blood vessel walls, which can leak fluid or blood into the surrounding tissue. Also, retinal ischemia can happen, where the blood supply gets compromised and areas of the retina can become deprived of oxygen, leading to further complications. Now, as the damage progresses, patients may experience visual disturbances and changes that warrant medical attention. Diabetic retinopathy progresses through distinct stages, each characterized by specific changes in the retina. Understanding these stages is crucial for early detection and effective intervention. Now, the first stage is mild non-proliferative diabetic retinopathy. I know these words might sound difficult, but trust me, even if you're not able to understand the words, getting to know how the disease progresses will help you. Now, in the first stage, the non-proliferative diabetic retinopathy stage, small bulges called microaneurysms may develop in the blood vessels. Now, these are often asymptomatic but can indicate underlying changes. After this, we move on to number two: moderate non-proliferative diabetic retinopathy. More significant changes occur with some blood vessels becoming blocked. This blockage can lead to retinal swelling and vision disturbances. The third stage is severe non-proliferative diabetic retinopathy. In this stage, numerous blood vessels are blocked, resulting in substantial areas of the retina being deprived of blood flow. The final stage is proliferative diabetic retinopathy. This advanced stage is marked by the growth of new, fragile blood vessels in response to retinal ischemia. These vessels are prone to leakage and can lead to serious vision loss if not treated on time. Now, diabetic retinopathy involves complex interactions between hyperglycemia, which is increased blood sugar, oxidative stress of it, and inflammatory processes. Chronic high blood sugar leads to changes in retinal blood flow and permeability, contributing to swelling and the formation of new blood vessels. Understanding these processes is crucial for developing targeted therapies for the patient. Now, as diabetic retinopathy progresses, Patients may notice symptoms such as blurred or fluctuating vision, dark spots or floaters in the eye, difficulty seeing in low light conditions, and sudden loss of vision. It is essential for patients to recognize these signs and seek prompt medical attention. Ignoring symptoms can lead to irreversible damage and vision loss. Early detection is crucial for managing diabetic retinopathy effectively. Regular eye exams can help identify changes in the retina before significant damage occurs. The American Diabetes Association recommends that individuals with diabetes have a comprehensive dilated eye exam at least once a year. For those with a history of retinopathy, more frequent monitoring may be necessary. Now, several diagnostic tools are used to evaluate the retina for signs of diabetic retinopathy, like a dilated eye exam, where eye care professionals use eye drops to widen the pupils, allowing for a clearer view of the retina. This exam helps identify abnormalities such as swelling, bleeding, or new blood vessel growth. Another one is fluorescent angiography. Now, this test involves injecting a dye into a vein in the arm, which travels to the blood vessels in the eye. A series of photographs are taken as the dye passes through the retinal vessels, helping to identify any leakage or blockages. Then we've got optical coherence tomography or OCT. Now, this is an imaging technique that provides cross sectional images of the retina, allowing detailed examination of its layers. OCT can detect subtle changes in the retina structure, helping to assess the severity of diabetic retinopathy. Now, understanding the results of these tests is crucial for patients. Eye care professionals will explain the findings and their implications. If diabetic retinopathy is diagnosed, treatment options and management strategies will be discussed. Now, patients should feel empowered to ask questions and clarify any uncertainties about their condition and the next steps. Now, several treatment options exist for diabetic retinopathy. Laser treatments are common and are an effective method for managing diabetic retinopathy, particularly in the proliferative stage. There are two primary types of laser treatments. The first is focal laser treatment, which targets specific areas of leakage in the retina, sealing off leaking blood vessels to reduce edema and prevent further damage. The next is pan-retinal photocoagulation. This extensive treatment creates small burns in the peripheral retina, reducing the stimulation for new blood vessel growth. PRP is especially effective for patients with proliferative diabetic retinopathy. Both of these methods aim to stabilize vision and prevent further deterioration. Patients may experience some discomfort during the procedure, but the risks of complications are generally low. Then we've got anti VEGF infections. VEGF means vascular endothelial growth factor. These medications are another promising treatment option. These injections they target the abnormal blood vessels that are developing due to diabetic retinopathy. By inhibiting VEGF, these drugs can reduce leakage, decrease swelling, and prevent the progression of the disease. Anti-VEGF injections have been shown to improve vision in many patients and are now a mainstay in treating diabetic macular edema. In advanced cases, surgical intervention may be necessary. Vitrectomy is a procedure that removes the vitreous gel from the eye along with any blood that has leaked into it. Now, what we do over here is we take some of that liquid out along with some blood that might have leaked into the eye. Now, this can help to improve vision and alleviate pressure on the retina because you have increased the amount of liquid in that one particular space. Now, while the surgery carries risks, it can be life changing for those with severe vision impairment. Now, research continues to advance the understanding and treatment of diabetic retinopathy. New therapies, including gene therapy and innovative drug delivery systems, they hold promise for the future. Continuous monitoring of patient outcomes will help refine treatment approaches and improve patient care. More important than the cure is always prevention. The golden rule of medicine applies everywhere. Prevention, something that we just don't think much of as to how our daily activities impact out life on a larger level. Talking about talking about prevention, the most critical aspect of preventing diabetic retinopathy is maintaining stable blood sugar levels. Effective diabetes management involves monitoring blood glucose regularly and adhering to prescribed medications. The goal is to keep the A1C levels or your sugar levels of the past 2-3 months under control at below 7%, as studies have shown that tight glycemic control, your blood sugar level control, it can significantly reduce the risk of developing retinopathy. In addition to medication, lifestyle choices play a pivotal role in diabetes management. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help regulate blood sugar levels. Regular physical activity, aiming for at least 150 minutes of moderate exercise per week, also contributes to overall health and can improve insulin sensitivity. Regular eye examinations are essential for early detection and prevention. Once diagnosed with diabetes, please initiate a conversation with your healthcare provider about setting up eye tests. This will allow your healthcare provider to catch any changes before they progress to more serious stages. Establishing a routine for eye care every year for those with diabetes can significantly reduce the risk of vision loss. Now, patients can also take proactive steps in their own self care journey. Keeping track of blood sugar levels, understanding dietary triggers, and recognizing early symptoms of retinopathy can empower individuals to take control of their health. Engaging in support groups also helps provide motivation and shared strategies for managing diabetes and its complications. And also in sharing strategies with other people for managing diabetes and its complications. For individuals diagnosed with diabetic retinopathy, adapting to changes in vision can be challenging but not impossible. Accepting that some adjustments will be necessary is crucial for maintaining a very positive outlook. Many people find that using visual aids, such as magnifiers, special glasses, or even smartphone applications, can help them continue with daily activities, whether it is reading, cooking, or enjoying their daily hobbies. Implementing simple strategies can make a significant impact, like organizing your environment, keeping spaces around you well lit and organized, which can help minimize hazards and enhance your safety. For example, using contrasting colors of your objects that you use daily can help identify them and reduce the likelihood of accidents. Now, for example, if your phone case is dark or it is black in color, you can ensure that all of your desk surfaces, all of your bed sheets, they are of a lighter color so that you can easily spot your phone. Same with other things that you own. Now, many modern devices come equipped with accessibility features that can aid those with vision impairments, like voice assistants in your phones. Text to speech options and larger display settings can make daily tasks easier. Now, it is perfectly okay to ask for help from family and friends when needed. Building a strong support network is essential for navigating the challenges posed by visions. Now, it is perfectly okay to ask for help from family and friends when needed. Building a stronger support network is essential for navigating the challenges posed by vision changes. Now, beyond practical adjustments, emotional and psychological support plays a vital role in coping with diabetic retinopathy. Engaging with support groups, either in person or online, can foster a sense of community and provide valuable insights from others who are experiencing similar challenges. Mental health professionals can also offer coping strategies and therapeutic options to deal with anxiety or depression stemming from vision changes. Now, education is empowering. Understanding the disease process and the importance of monitoring can help individuals feel more in control of their health. Patients should take an active role in their care, asking questions during appointments and seeking clarification on any aspect of their diagnosis or treatment plan. Now, when we talk about advances in medicine, we need to understand that research is continually evolving, with promising new therapies on the horizon. The use of gene therapy to target specific pathways in diabetic retinopathy is an interesting area of investigation. These approaches aim to correct the underlying molecular defects caused by diabetes, potentially providing a long term solution rather than a symptomatic relief. Artificial intelligence is also making waves in the field of ophthalmology. AI systems can analyze retinal images for signs of diabetic retinopathy with remarkable accuracy. potentially increasing the speed and efficiency of diagnosis. Now, as AI technologies advance, it could become a standard tool in primary care settings, allowing for early detection and treatment of diabetic retinopathy. Long term studies are essential for understanding how diabetes affects eye health over time. Ongoing research will help identify risk factors for progression, improve screening protocols, and refine treatment options. It is crucial for patients to stay informed about new developments and participate in discussions about their care. To recap this episode, now, diabetes can lead to changes in blood vessels that affect vision. You need to schedule annual eye exams to catch early signs of diabetic retinopathy. You need to maintain your blood glucose levels because it is very essential for prevention. Utilize assistive technologies and community resources to enhance your quality of life. Personally, you need to keep up with the latest research and treatments available to manage diabetic retinopathy effectively. Or you can even ask your doctor about the latest treatments that are available at the moment, or whichever treatment are applicable to you, because each and every single patient is different. Now, as we wrap up today's episode, it is important to remember that while diabetic retinopathy poses significant challenges, there is hope through education, proactive management, and ongoing research. Each person's journey with diabetes is unique, but knowledge and awareness can pave the way for a brighter, more informed future. If you or someone you know is living with diabetes, encourage them to take charge of their eye health and seek regular evaluation. Now, if you found this episode helpful, please share it with your friends and family who may benefit. Together, we can spread awareness about the impact of diabetes on your vision and promote proactive measures for prevention and management. Remember, your vision is worth protecting. Thank you for tuning in to today's episode. I have covered diabetes in a previous episode, which I will be plugging in over here. You can check it in one of the cards on the edge of the video. Until next time, take care of your health and thank you for making health a dinner table conversation.